We are back here on Girl Talk. Yes, it's a beautiful Lowcountry day. And Dr. Brad just went to see patients, so we have Dr. Moshe Dekel here. Thank you for joining us, sir. And we were talking, we actually had Brad captive for 10 minutes, and now we have you captive. So this is going to be fun. Let's talk a little bit, if we can, about your transition or transformation from medical doctor to medical doctor, functional physician, holistic doctor. If you would share with us a little bit about what that looks like.
Yeah, of course, because it's a frequent question that comes to me. I've been an OBGYN at that time for about 20-some years.
Okay.
And then my neck and back, I say, you know, you're out of the picture here, because after 5 hours a day of doing surgery with getting a neck crooked, my neck and back said, you know, you're out of surgery. So obviously it was not a good day at that time. But I opened the door to what I call the real medicine, holistic medicine. It was kind of serendipitously in a way. But when I realized how much they didn't teach me in medical school as far as what health is all about, and the fact that medication, as I learned later on, are really not good for us long term, almost none of them, I re-educated myself, and for the last 20 years, actually since 2000, I've been treating my patients holistically only, no medication, and able to help them in a much more profound way.
Which is really brilliant. I want to talk a little bit, if we can, also about Rejuvenate. You are open. Dr. Brad said you're busy. Things are wonderful, and that's exciting to know also.
Of course. Actually, to tell you the truth, we never closed.
Okay, good.
Okay, there was no reason to close, because from my perspective, this is not more than the flu. Okay, it can be dangerous, but regular precautions, and we take precautions in the office. We clean very thoroughly, we take temperatures. Anybody wants a mask, that doesn't have a mask, we give them a mask. But yes, the answer is we've been open, and finally people are willing to get out of the house.
Yes,
and they realize, you know what, my aches and pains and other medical problems should take some priority here.
Well, because this is Girl Talk, and we had a chance to talk a little bit before, we were sharing what might be some really interesting things that we could talk about. And one of the things that you mentioned were hormones, both for women and for men.
Yes, extremely important, because there's so many misinformation about hormones replacement.
Well, let's talk about hormones first. What is a hormone? How about that? We go to the basics.
Excellent. Hormone is a protein.
Okay.
A protein that has a tremendous effect on specific organ or set of organs in the body. For instance, thyroid hormone, thyroid is right here, affects every cell in the body. It tells every cell in the body how much energy to make. Estrogen, of course, affects the breast, the uterus, the brain, very important, the bones, the skin. Progesterone, the same way. Brain, bones, muscles.
Okay.
Mood, sexuality, ability to achieve orgasms. So hormones are small little proteins, but with huge effect.
What about testosterone too?
Oh, let's not forget about that.
That's right, see?
Absolutely. Well, testosterone is so important for men, more than sexuality, by the way. It's interesting to note that men have more receptors for testosterone in the brain than the genitals. So in other words, if we do not have enough testosterone, we just don't function well. In addition to that, it's important for bones, for muscles. As we age, as we get low testosterone, we actually lose muscle mass. Okay, but it's especially important for mood and sexual function.
So when someone comes into you and they're just presenting a history, is it at that point that you can test for hormones? Tell me about some of the procedures that you would do, or not procedures, but just the interventions.
Okay, if we talk about girls at this point, obviously I listen to the story. It's very important. I look at menstrual history. I look to see, okay, what age are you at? Are you premenopausal? Are you transitioning? Are you postmenopausal? Do you have any symptoms? What are they? Okay, so even before I do any testing, I know already where we are.
What would a symptom look like? In other words, I did ask Dr. Brad this too, is I'm not sure I would know. Are women good historians? Do we know what is symptomatic? I mean, do they come in and say, I don't know. You know, I'm tired, grumpy, I don't know.
Excellent point. It's not so much about being good historian, it's about asking the right questions.
Ah.
And now you're responding accordingly because I'm going to say, okay, do you sleep well? Okay.
Okay, got it.
How's your mood? Do you have any hot flashes? Do you have any vaginal dryness? How's your libido?
Okay.
Okay.
So
Are you
you're
gaining
going
weight?
to lead my responses.
Exactly.
I like that,
So
the
if they're not a good
questions.
historian, I ask the questions. And it's very evident as we have the conversation also to the patient that, okay, because what happens, we start to take it, okay, I'm aging, I'm getting older. Oh, my mom did send my, it's expected. And what I would like to tell our patients that it's not expected. It can be addressed, it can be treated. There's really no way to have any kind of discomfort as we transition to menopause because today we live in menopause for 40, 50 years.
Wow.
It's not like, the early 1900s that women and
Died.
men survived to be about 50.
That's
so
exactly
there's no big
right.
deal. But today, 80s, 90s, and even
Right.
beyond. So why not have protection for any and all of the symptoms? And also, it's very important, we actually slow down the aging process. And it's so important. And, somebody says age gracefully. I like to say, slow down the aging as little as possible and die in your sleep, happy.
Yeah, that makes so much sense. So when people come in with hormone issues and you test for that, then are you giving replacements? Or now we're back to where you started?
Yes, yes, that's the whole idea. And again, that's a lot of misinformation. I do not use prescription drugs.
Okay.
I use only bioidentical hormones, which means what? It means the same structure of the ovaries producing estrogen, progesterone. It's the same thing, and it's natural usually because it's made from soy or yam.
Okay.
So it's totally natural. Obviously, every patient may need a different amount, different way of doing it. Therefore, I do also blood testing to see where we are.
Okay.
And also we can do saliva testing, we can do urine testing, we can do various testing to kind of support the modality or the way we address the issue. But I want to let you know that even though the labs are important, it's not the Bible.
Okay.
The Bible is the patient.
Got it.
What she tells me, how she feels, and what the clinical picture is, and how she improves as we do the treatment.
Is the
So
important
the
piece.
testing is a guideline, important, but only a guideline. I listen to my patients and looking to say, I'm great.
That is a brilliant response because my takeaway for this is really you care about me, the person, me, the patient.
Exactly.
Now, we talked about the women and hormones. You were sharing a little bit before about men with erectile dysfunction and hormonal issues also as being really important, and there were some great treatments.
Absolutely. Men lose testosterone to the tune of 1 to 2% per year from the age of 25. So by the time we're 50, 60, etc., we're working on 50% on what we used to work on the age of 20. By the age of 55, erectile dysfunction is 50%.
Okay.
It's really off the chart. So yes, we check for testosterone.
Okay.
If there's any problem with that, I supplement men. We can do it two ways: either injection, self-induced, or a cream.
Okay.
Okay. But again, I ask them the story. I find out what's going on. I take the blood testing, and this is one way. I mean, hormone replacement is it's not easy, but it's not that difficult, number one. But also we have another non-invasive procedure called Gaines waves. It's called extracorporeal shock therapy.
Wow.
Okay, it's a little device that has a little bullet in there that moves very fast, hits a plastic cap that produces a shock wave. This has been in Europe for the last 15 years.
We're a little slower.
Yeah, it just came to the country a couple of years ago. Anyway, 80% of men, and it's not invasive.
Oh, wow.
And it improves erectile function by about 80% of the time. And it's for everybody, those who have erectile dysfunction or those who want to just improve the functionality.
What's really interesting to me is you and Dr. Brad have had the whole show, and I feel like we're just getting started, and we're definitely talking about the tip of the iceberg. You do so many amazing things. We would love to have you come back again. And again, like I said, we just shared 3 or 4 different things, and there are just a myriad of techniques and interventions that you have. So we want to thank you, Dr. Moshe. We want to thank all of you for joining us here in the Lowcountry outside for Girl Talk. Bye-bye.